Hello, my name is Dr. Troy Giles. I'm a doctor of chiropractic. I've been practicing now for about 17 years, and I've had some wonderful experiences during that 17 years. I've treated over 10,000 patients and over 90,000 office visits. And to be able to bring that up to you so that you understand that there is the ability to do some great work with your patients using kinesiology. So I want to explain a little bit about kinesiology, what it is, how it works. Roughly, kinesiology is the ability to ask your patient any question that you might have in response to what the symptom picture is that they're presenting with. When a patient presents, they never present with just one concept. It's usually a multifaceted idea. So we can do as many blood work issues, we can do chemistry, stool analysis, anything that we want. But the important thing that we want to do is to be able to determine what is the priority for the patient. Let's say we did a stool analysis with Erica. This, by the way, is Erica, and I appreciate her being with us today. Let's say we did a stool analysis with Erica, and we found out that she had a virus, a parasite, fungus, and a bacteria, which is not uncommon. And that came back on our blood work and on our stool analysis. Which one of those would we work with first? That's the idea of using kinesiology. I think if we can use kinesiology, even with our medical doctors or any healthcare practitioner, I think we would be much more specific in our ability to treat and have much greater results. Let's say that, for example, with Erica, she might weigh 110 pounds. So we would say, according to the dosage, we would give her 3 capsules of an antibiotic for that day. But maybe Erica's liver isn't working the way that it should, so that she literally could only handle 2 a day. So if we could use kinesiology to determine dosage and priorities, we're going to have a much greater ability to do that. So when I'm working with a patient, I explain to them what I'm going to be doing. This is after I've done a good examination. We've done all of our testing, our reports are back in, and now we want to set up and give the patient a supplementation program. We want to now use the kinesiology at this point to work. So when I'm explaining to the patient what kinesiology does and how it works, it's just the flow of energy, flow of electromagnetic energy. There's no voodoo, there's no weird things involved with it. It's just straight out electromagnetic energy. Because we are electric and we're magnetic. Literally, our aura has been studied at UCLA. It was probably done 25 years ago now, where they studied with Kirlian photography the energy flow of the body. So they were able to take somebody in this position and actually videotape that energy flow. So using that same energy flow, electricity and magnetism, we're going to be able to work with the patient. So Erica, what I want to do now is explain to you, because you've never really had the opportunity to do any kinesiology, I want to explain to you how this is going to work. What we want to do first off is we just want to practice what it's like if I push down on your arm, you're going to push up, and you're going to meet my pressure. You notice the words now. Meet my pressure means don't resist. If I say the word resist, that carries a negative connotation. So as you say this to the patient, don't say resist. Say meet my pressure. So you're going to hold your arm here for me, and you're going to push up, and I'm going to push down. Okay? So go ahead and just push right up for me. Okay, so that's a good strong arm. Do you have any pain in the shoulder or elbow or wrist?
No.
Does that cause any pain anywhere in your body when I push down?
No.
You want to determine that, because they might have, let's say, an irritation or inflammation in the deltoid. So as I push down their arm, they might be having pain, which will give us a false negative or a false positive. So, Erica, go ahead and hold up again. I'm pushing down, you're pushing up, okay? So that's very strong. You feel that?
Yes.
Now what I'm going to do is I'm going to put my hand on your stomach, right over your belly button.
Okay.
In anatomical position, the front part of the body is positive, back part is negative. So if we put you in this position, I am positive on this side. Erica as well is positive on her front side as well. If I put my hand on your belly button, just over the solar plexus, now first off push up. This is good and strong. Okay, now if I push on your abdomen, and I don't push, I just put my hand over this and I push, you can feel it start to drop versus this. That's very strong.
Yes.
This is starting to drop.
Yes.
Okay, so my test isn't to try to get their arm down and overpower them. We don't want to cause fatigue of the deltoid, nor do we want to blow it out or hurt the muscle itself. So if I push down on the deltoid and it's good and strong, that's going to be my indicator muscle of the energy flow in her body. Okay? So we're going to practice first off, and that's what you say to the patient. We're going to practice this first. So you can feel what a strong arm is versus a weak arm. That's very important. Okay, so that feels comfortable. We've gone ahead now and we've pushed up. That's very strong on your arm. And this again is weak. Now, when I touch the reflex points on your body, there's a reflex point on every organ in your body. So as I touch that reflex point, I'm looking for areas where the arm is going to get weak and drop. Okay? So whatever symptom picture you might be having, if I touch that reflex point and there's a dropping, we know that there's basically less aura, less electromagnetic energy in that reflex point or in that organ system. Okay? So for example, if I were to touch your thyroid, and if there was a thyroid issue, you're going to have less electrical flow just by me touching. This is now a circuit of energy. Okay? If I put my finger in the electrical light socket over here, or in the, you would get zapped, and if we have 20 people holding hands, they would all get zapped. Interesting, I used to have a little chicken that I got, an Easter chicken, and this was a great way to explain the energy flow. This little chicken would sit in your palm of your hand, and it had 2 electrodes, 2 little metal pieces that stuck out of the bottom. When you put it in your hand, it would connect through your hand, and the chicken would, little chicken would chirp. Chirp, chirp, chirp. Mm-hmm. Well, I would have the patient, I would tip it upside down, and I would hold one side, and she would hold the other electrode, and it wouldn't chirp, because it wasn't connected up. But if I touched her hand, this was a circuit between the chicken, it would start to chirp again. Well, I did one time a session, and I had about 30 people holding hands. And over here, well, you and I were holding the duck, or the chicken, and they would break hands over here 15 feet away, and the chicken would quit chirping. It was amazing. It was simply amazing. But that's just energy flow. That's all we're talking about. So when I touch you over whatever point, if I touch here, this is a circuit of energy, and if there's a problem in your liver or whatever reflex point that is, your deltoid gets a less electrical flow, your arm will get weak and it'll drop. Okay? So that's how we're going to go. So first off, that's kind of how the flow goes. Now next we want to check, as we proceed through the process, we want to look for weak organs. So number 1 is brain. Number 2 is cerebrospinal. And that cerebrospinal is going to represent the flow of fluid in the cerebrospinal fluid. Number 3 is crown. That works with crown chakra. That's the major energy flow from the universe, basically down to you as a person. Number 4 is cerebellum. That point would be an issue with somebody with Parkinson's or with any other kind of issues in the back of the brain. Number 5 is on the side of the head. That's for pituitary. That's your master gland that controls all other hormone function. Number 6 is pineal. The pineal gland is your sleep center. So if you're having trouble sleeping, that's the point of the drop. Going into 7, number 7 is going to be your upper sinuses. Then 8 is eyes. 9 is lower sinus. 10 is ears. And you'll see here in a minute when I represent that, I'm going to touch both ears. Number 11 is your upper teeth. 12 is lower teeth. 13 is thyroid, and 14 parathyroid. Parathyroid, of course, is for your calcium metabolism and other mineral metabolism. 15 is lung, thymus, and lung, taking over to 17. 18 is heart. 19 breast. 20 is the opposite breast. 21 bile duct. 22 liver. 23 gallbladder. 24 stomach. 25 small intestine. 26 spleen. 27 pancreas. 28 colon. 29 female and male. 30 is kidneys. 31 adrenals. 32 lymph, and 33 blood. This is a very good chart, and this will help you to be able to learn the points. As you start to scan, you can keep this right in front of you and do the scan. This also comes in a nice poster you can put on your wall as well if you'd like to have that for your office. Now as we proceed, I'm going to make reference to the page, so keep it handy. But I'm now just going to go through and show you how that looks, how my hand touches Erica. So first is brain. That's just basically at the scalp line. Now realize that these aren't specific. You got to be 2 centimeters above the scalp line and 2.5 centimeters left of center. No, it doesn't have to be that specific. And in reality, you don't even really need to touch the patient, because you got to realize the aura is extending clear out over here. Clear out over here where you can't even see me, it's out to here. You understand that? So aura comes out. So this, and I'm going to take even a further step away from this, you can actually do scanning long distance. That sounds weird, but it works with quantum physics. Quantum physics says that energy is never created nor destroyed. It goes out from us forever. So I have patients, for example, who are on the other side of the world who will call me to have a scan done. And I can actually scan them either using a proxy person or just thought as thinking of the different points as I'm thinking of that person. And I feel a change in my muscles here with a yes or a no question. Anyway, that's elongated, that's fringy, that's far out, but it works well. But suffice it to say, the energy leaves us and goes out. We don't have to be that specific. I don't have to be on a precise area. But this is the first point, is brain. Cerebral spinal is right at the crown, right at the very top. Go ahead and bend over. So this is cerebral spinal fluid. This is crown. Now cerebral spinal fluid pulls up quite often with headaches. We'll have a low-grade meningitis. It could be a viral or a bacterial meningitis that's not acute. It's not huge fevering and they've got a massive headache. This many times will show just that they've got a low-grade infection in the cerebral spinal fluid. So that point will drop. So that's crown. Let's have you stand up, Erica. Cerebellum, face me here. Cerebellum would be right here at the base. That's cerebellum. Coming to the side over here, it could be on either side, but right in the center here is the pituitary. Literally, the position of the pituitary is from here and here. If you draw a line together, that's where that intersects. So pituitary. Pineal is right here in the center. When I touch upper sinus, I actually kind of hold it and catch everything. Upper sinus and lower sinus here. Eyes, ears, upper teeth, and lower teeth. And what I'm doing is I'm kind of contacting the whole area here. I'm making it so that whole area is being contacted. So upper teeth, lower teeth, ears, thyroid, parathyroid, lung, thymus. Thymus sits right here at the notch. Thymus, lung, heart, breast, breast. Now when I'm touching breast, so you maintain your appropriate sexual boundary, the breast tissue comes here and all the way up into the axilla. It's going to come clear up into the armpit. So I'm definitely, and you feel, Arca, you feel this comfortable, me touching at this point. That feels comfortable with you. So make sure that you maintain the sexual boundary always. Always, always, always. Never, ever let your mind go into any kind of negative issue as far as a sexual thought. The patient will feel it and they won't come back. So maintain your ethics and your integrity in this area. So you do breast, breast. Now if a breast issue does fall, in other words, if I'm over here and I say breast and the arm drops, then what I'll do is I'll have her hold, I'll touch her hand, and I might have her touch different points of her breast. We can isolate where an issue would be, so that then she could go and say, okay, I need a mammogram, and talk to her gynecologist and figure out from there. But we could still be working possibly in maybe a parasite or a virus or fungus in the breast tissue. Very common that breast lumps will come as a layer of infection is in the milk duct or the lymphatic glands of the breast tissue. So that's the breast. Then coming down here, we're going to seesaw. Now watch your chart here. We kind of like seesaw like the teeth of a saw. This is bile duct. Liver is right underneath the breast, right next, just right against the rib. So bile duct, liver. Down is gallbladder. Up is stomach. Down, small intestine. Right up underneath the left is spleen, and then pancreas. So you're just going to seesawing right through that. So bile duct, liver, gallbladder, stomach, small intestine, spleen, pancreas. Then we have descending colon, ascending colon, transverse colon, sigmoid colon. If you want, or you can just do colon in itself. But you can think about it. Ascending is on the right side, transverse, descending, sigmoid, and then you're going to bleed through the rectum and anus. Okay, then female, and I'll either have the patient touch the female and just put your hand like this, and I'll check here. So what you're doing is accessing that reflex point. Okay, if this point were to go weak, then I would break the female or the area down, either male or female, into the specific points or specific parts. So I would actually have her with her own hand, right ovary, left ovary, uterus, bladder, vaginal. If it's a male, same thing. Right testicle, left testicle, penis, prostate. So you can determine the specific points. If it does drop, you can go into that type of specificity. Well, let's have you go and stand up now and turn face the back. So then we're moving around to the back area. Now we have kidney and adrenal. Kidney is basically in this area, and adrenal sits right on top of the kidney. Okay, and back around. And the last two are blood and lymph. Now this is an area, if you think about it, there's the vein, the major femoral vein, artery, and nerve run right up through this area here. And this is also an area, thank you, and sit back down. This is also an area of a lot of lymphatic areas as well. Where the extremities hit the trunk is where you'll find a lot of lymphatic. So we say lymph and blood. Those are just the points to help the body recognize that's what you're asking. Okay, so those are the points. So I'm going to go through them again now. Brain, cerebral spinal, crown, reaching around the back of the head, cerebellum, pituitary, pineal, upper sinus, lower sinus, eyes, ears, upper teeth, lower teeth, thyroid, parathyroid, lung, thymus, lung, heart, breast, bile duct, liver, gallbladder, stomach, small intestine, spleen, pancreas, descending colon, ascending colon, transverse colon, sigmoid colon, and female. Sometimes I'll just even just put my hand out here, female, because remember the aura is coming out. On an existing patient that's comfortable with you and understands what you're doing, I'll just buzz through it, female, and I'll just hold that here, female. Come around and touch kidneys, adrenals, lymph, blood. Okay. Now what I'm going to do is I'm going to go ahead and scan Erica. She's asked me to go ahead and scan her as a real patient. So these are actually going to come up, and we're going to write the specific things down. All right, so first off, we're going to practice. Push. That's good and strong. And I'll touch the abdomen and push. And that's weak. So that's what we're looking for, is that droppage. Just that little bobble. Okay? Here we go. Brain, cerebral spinal, crown, cerebellum, pituitary. So pituitary is weak, that's dropping. That's a bobble. So pituitary, pineal, upper sinus, so you got the pituitary drop. Upper sinus, lower sinus. Eyes, ears. Now, with eyes, you can actually push into the eye a little bit. Not too hard, but just enough that if there's any glaucoma or pressure in the eyes, you're causing pressure or further lesion. Okay, whenever we're doing an orthopedic test or anything else like that, we're trying to see if we push the body further into a problem, further into lesion, does it cause a change in the body? So by just touching the eyes this much, that's not too much, that's just a little bit of pressure. If the arm goes weak, that's going to give us an indicator of glaucoma or any kind of pressure in the eyes. So eyes, ears, upper teeth, lower teeth, upper teeth, lower teeth, thyroid. Thyroid's weak too. So pituitary, thyroid. Now, Erica has a little bit of a lump, and I don't know if you can notice it right here. And when did this come on?
About a year.
A year ago.
A year and a half.
And what happened a year and a half ago? Anything you can think of? Baby, anything?
I had a child.
You did have a child?
I had a child. He's 3 now.
Okay.
So I had finished nursing him, though. I nursed him for almost 2 years.
Okay. So you just finished nursing him, and that's roughly that same time as when it popped up.
Yeah.
Okay, so when you're thinking thyroid, diagnostically you're thinking metabolism. She's nursed him now for 2 years. She's been drawn, literally, energy and nutrient has been drawn from her during this process. So fatigue is something you'd want to think about. So I'm going to think about endocrine. Pituitary dropped, thyroid dropped. More than likely, when we get over here, adrenals will drop. I don't want to put that out automatically, but more than likely that overall endocrine system will drop as well. Many times on thyroid, when there's an inflammation or a bulge there, if you will, that indicates a layer of infection, and we find many times microparasite, small parasite in the thyroid. So thyroid drops. Lung, thymus, lung, heart, breast, bile duct, liver, gallbladder, stomach, small intestine, spleen, pancreas, colon, female. See, so you notice I just went female, but let's do that. Go ahead and go female. So if she touches, and you can just say, put your hand here, go ahead and put your hand here, and we're connecting a circuit by me touching her arm. Female, good. Kidneys, adrenals. Adrenals are strong. Lymph, blood. Okay, so there's two issues. We've got pituitary and thyroid. So those are the highest priority organs. So first off, when we're actually doing our scan, now we're right into the meat and potatoes of it. We now, with practice with it, she understands what a strong arm and a weak arm is. We're now moving in to check to see what organ systems are weak. So on our scan, we found pituitary and thyroid. Now we're going to find out what priority is. So of those two, we want to see which one is strong. Pituitary, thyroid. So they're both top priority. If I were to have, let's say I have pituitary, thyroid, liver, and colon, which one of these am I going to work with first? Which one is the body's top priority? So I would go back down, and I would look for the one where the arm drops, if you will. So pituitary would be strong, thyroid would be strong, liver would go weak, wouldn't let your arm go weak. So if this one dropped, this one would be priority. After we find out the top 4 or 5 or whatever organs show that are a problem, we now want to go and find out which one of those 4 is the top priority. In this case, they both show that it's being affected by whatever is the issue. Okay? Now what I'm going to do is start to use my test kit. This is a phenomenal test kit. It's very, very specific. It's very small. We have the organ or the infection fibers on this side, and we have all of the organ systems here. Every one of the supplements is either in capsule form, in the actual herbal capsule form. It's also in the liquid form. And the liquid form is just a stewing or a extraction of the actual herb. So that makes it very, very nice. But what we're going to do is we're going to go ahead and check and see if there is, first off, an infection. So now we found weak organs. Next we went to the top priority organ. So we found pituitary and thyroid. So we're just going to go ahead and check. We're going to look for pituitary. We're just going to touch over this point and push. Now at this point I usually explain to the patient, how is it that if I touch this to your pituitary point that it makes it strong? Did you feel the difference? Push. That's very strong. Touching pituitary again, that starts to bobble. Touching this back again is very strong. There's no bobble. And what you're trying to do is it's about like this, 1/1000. Okay? At 1/1000 or a second, usually if it's a problem, it's going to go 1/1000 and start to bobble. If it's strong, it's 1/1000. There's no bobble. It just locks. It's a locking feeling. So I stop right now and I tell the patient, are you questioning why? And usually they'll say, well, how does that work? I either tell them or they'll ask me. Electrons, protons, and neutrons, studied that in 7th grade chemistry. They're in orbit. Do you remember there was like a nucleus and there was an electron way out there? The glass has electrons, protons, and neutrons, as does the supplement, and both of those are in orbit. This has an electrical field to it. If this is right for you, if it balances you or resonates well with your electricity, as I touch this to the point, your arm will become strong if it's resonating for you. Does that make sense?
Yes.
So if I touch here and push, very strong. So that one looks good. So pituitary we would work with, and now we're going to look at thyroid. So thyroid, checking here, that's very strong. Okay, now I want to see if there's an infection. Okay, so what I'm going to do here is I'm just going to touch her with the various infections. So bacteria, looking for what makes it strong, and that does not. That's not strong. Meta X is for metals, heavy metals, chemicals. That does not. Microcyte is small parasite. Microcyte. Okay, now that shows fairly strong. So we're going to go back and check that in a minute. Paramac is a large parasite, and that does not. That bobbles. Fungus, fungex, fungus. That does not. And Virox for virus. and that does not. So the one that shows the strongest is microcyte, and that's very strong. Do you feel that?
Mm-hmm.
That's very, very strong.
Mm-hmm.
You're sure? You feel that 100%?
Yes.
Because you want to get the patient to say yes. Because if they don't, if they're questioning is it work or not, they're not going to follow the therapy. So it's very important, even if you need to go back and recheck it, is that strong or is that weak? And don't doubt yourself. Let yourself go with it, because when you doubt it, it puts a negative flow into the energy system and it knocks it out. Okay, so microcyte now is an infection, a microscopic parasite, which is very common. Microscopic parasites are like smaller than amoebas. Amoeba would be up micro as well. But they're able to go in and out of cells very easily. So they go in and out of tissues. It's amazing. So, and not that I predisposed my mind to think that microcyte was it. It's just very, very common that enlarged thyroid, it has an issue with microparasite. Okay, so that's good. So this one shows strong. Next thing we look for the infection. Now we look to see what we want to do as far as supporting the organ system itself. So do we need to use pituitary here now? Very strong. And thyroid, very strong. Now if I put all three of those together for thyroid, very, very strong. Remembering what that's like without it, touching this, and you start to bobble. You good?
Mm-hmm.
All right, so then, now we want to see if there are any secondary organs to support. Now what I would do, in this case, because it was so easy, there was only two organs. If there were 4 organs, well, we found out that remember we said pituitary, thyroid, liver, and colon were our 4 before, as an example. If we found that the liver was the priority, we would then check to see what infection is in the liver. We then check to see if the support for the liver is necessary. We would then go in and see if the other organs were needed as well. So we would go back and check for pituitary, thyroid, and colon. Are you following me there? That's very important that you get that. With Erica, it was easy because you only had the 2 points, the 2 infections that were weak. But in our example where we had pituitary, thyroid, liver, and colon, there were 4. We need to find out priority, which one is top priority organ. So let's say that it was liver. We then check to see what infection was in liver. Let's just say that it was parasite. We then check to see then if we take the microcyte with liver G. Liver G is for the liver. Okay, we'd make that strong. If that was strong, then we'd ask, do we need to work with pituitary, thyroid, or colon as the supporting organs that were also weakened? Let's do the scan. This was strong. So then we'd ask, is pituitary needed? And let's say the arm goes weak. Go ahead and let your arm weak. So then we wouldn't use pituitary. Let's then do colon and let your arm go weak. So colon doesn't show either. So what we would be doing would be liver and microcyte, because that was our top priority organ, top priority infection. We then check to see if our associated organs were a problem, and they were not. Then the last thing we do is check to see if we need to detoxify. We call this Tox-X. This helps to pull the toxin out. So do we check for Tox-X? So our priority then would be liver G, microcyte, and Tox-X. That's an example there. All right. Next thing we would do is dose. So we need to now make a dosage. So what we're going to do is go back and check to see how much we should give her. So now let's say we're still using our example of the liver. We're checking microcyte. We're going to count until the arm goes weak. So we go 1, so you just go ahead and push up. 1, 2, and 3. Let's say 3 it drops. We would give her 3 a day of the microcyte. Then we bring in the liver G. Again counting 1, 2, 3, and 3 it drops. So we'd give her 3 on the liver G. And then we check Tox-X. 1, 2, 3. Let's just say that it went 4, it dropped on 4, we'd give her 4 Tox-X. Okay? Usually speaking, I suggest going breakfast, lunch, dinner, bedtime of whatever supplement we're working with. Liver G, I like to give 2 upon rising, 2 before bed, empty stomach, because liver, for example, really is able to absorb the nutrients on an empty stomach, so it goes right into the liver very well. Okay, going back now to Erica's actual case. Okay, we have pituitary and thyroid. So we want to look at microcyte. Taking microcyte at 1, 2, 3. She bobbles at 3. So I'm going to have her take 3. And what I want to check is, do we give her these at bedtime, or do I give them throughout the day? So we want to ask, do we give this to you throughout the day? And that's a strong arm. Now when I ask yes or no questions, yes is a strong arm, weakened is yes are strong, weakened is no. Okay, so if you're asking just a yes or no question, strong arm is yes, weak arm is no. You understand that?
Mm-hmm.
That makes sense?
Mm-hmm.
So if I said, say your name is Erica. You say, my name is Erica.
My name is Erica.
Okay. Say my name is Troy.
My name is Troy.
So when you say my name is Troy,
Right.
it's a negative. It's a falsehood. So when I'm asking her body, you say, well, what do you mean you're asking her body? How does that work? Well, literally you're asking her spirit, her electromagnetic energy, her aura, whatever. The thing that knows everything about your body is your spirit. It's the thing that makes you move. It knows it all. It's our job as practitioners to extract that information. Okay, very good. So we want microcyte, and do we already ask if it was during the day or at nighttime? I can't remember.
During the day is
It was during the day. So we want to go breakfast, lunch, dinner. Is that correct? And that's strong, so yes. Now we're going to go for pituitary. On the pituitary dose, we're taking 1, 2, 3. So we're going to go 3 a day of that. And let's pick up thyroid. Taking thyroid at 1, 2, 3. So we're going to go 3 a day. Now, you're probably not noticing as much change because I've done it for so long. I can feel it start to change before you even recognize that it's starting to drop. As you get used to this, you'll start to kind of sense the energy of it, if you will. When you're counting 1, 2, you can start to feel that it's going to drop with 3. That's just kind of how it goes. So what we've got is 3 thyroidin, 3 pituitin, and 3 microcyte, taking breakfast, lunch, and dinner. So what do you do if we've got the top priority organ, top priority infection, organ system support, secondary organ system support? The last thing then we need to make sure of is, do we need to detoxify? Generally speaking, if I give a layer of infection, support, we want to kill something, if we're going to get rid of parasite, we want to use the Tox-X. The Tox-X acts as a sponge. So you're going to sponge up the die-off. So think about that. If there's a small parasite here, and you probably have it throughout your body in other areas as well. If we have that and it's starting to die off, we want to put in a sponge to pull those toxins out. So Tox-X, I'll give this as an example to patients. If we have a cabin in the mountains and we're gathering rainwater off the roof, and it comes off and comes into a 50-gallon jug of big rain barrel. Mm-hmm. Well, over time, the dirt in that water is going to settle out to the bottom of the barrel. If my job is to reach in and grab that gunk out of that barrel and clean it out, it's going to make that water dirty as I'm cleaning it out. So if we threw a sponge in that had the ability to absorb that stuff, that would make the water very clean. So that's an issue. So we want to get in and throw in the Tox-X to try to sponge those toxins out of there. That's the idea of that. Okay? So in repass now, the first thing we do is go over and explain the energy flow and the practice the strong arm with the patient, so they understand the strong arm. The next thing is we look for the weakened reflexes, the weakened reflex points. Of the weakened reflex points, we look for the highest priority reflex point, the highest priority. Once we find the highest priority, we then look for infections, seeing if there are any layers of infection. Once we determine if there's a layer of infection, we then check to see if we want to support that particular organ that was weak, the top priority organ, with the supplement. We then want to go back and check any of the other weakened reflex points to see if they too need to be supported. We then check to see if we need to detoxify using the Tox-X. And then after that we go through and create the dosage of how much each of the supplements should have and at what time they should be this should be given during that day. Very good. Now the next thing that we do is we write it down on our supplement page. We actually write down for the patient when to take it, and we give them a specific treatment plan. You'll take this now for the next 2 weeks, and then we'll reevaluate you. So I'll see you back at the practice in 2 weeks, and we'll go from there. As I'm working with a patient on nutrition, I usually see them about every 2 weeks. And I'm a chiropractor as well, so most all of my patients are working structural issues as well. So they might be on a plan of 3 times a week, repairing the soft tissue, straightening scoliosis or whatever we're working with, as we're also working on the supplementation. But make sure that the patient doesn't run out of what they need. Say you're going to see them in a month. Maybe we don't see Erica now for a month. Normally in my practice we see them every 2 weeks, and we check the supplementation as we're working with them in a chiropractic setting. But as a massage therapist or any other maybe nutritional counselor, you might not see her then for a month. Just make sure that she has enough to handle that for that month. So I hope this has been beneficial for you. If you have any questions with this, feel free to contact Inno-Vita, asking them any questions. They can refer you to me as well. I can answer anything there as well. So don't be afraid. Let your heart just be open and practice as much as you possibly can with your family, your friends, whoever, and you'll be able to just do a wonderful work here. So until next time, have an awesome day.